unresponsive hiker is found not breathing adequately. An oropharyngeal airway is placed to open their airway, but ventilation remains difficult. Consider insertion of a supraglottic airway device or endotracheal intubation for definitive control of the airway. Paramedics arrive at the scene of a motorcycle collision. The rider is unconscious with irregular agonal breathing. The team leader directs setup of airway equipment in case advanced interventions are needed, while initial assessment proceeds. An elderly patient experiences sudden onset left-sided weakness and garbled speech, concerning for acute ischemic stroke. The pre-hospital team performs a Cincinnati pre-hospital stroke scale exam showing right-sided facial droop and left arm drift, confirming a positive stroke screen. A trauma patient is pinned in a vehicle after a rollover MVC. Once extricated, he has profound hypotension and mental status changes concerning for hemorrhagic shock. Initiate the trauma primary survey looking for sources of bleeding while administering warmed IV fluids. Anaphylaxis is suspected in a patient experiencing diffuse hives, edema, and hypotension after an insect sting. Give IM epinephrine, IV fluids, supplemental oxygen, and monitor cardiac rhythm, as the distributive shock state can precipitate lethal dysrhythmias. A combative head trauma patient requires medication sedation for air medical transport, but becomes hypoxic after doses given. Be prepared to manage the airway in case respiratory depression ensues, even up to intubation if less invasive measures fail. Mantle cell lymphoma patient receiving chemotherapy develops fever, isolated hypotension, and is difficult aroused suggestive of septic shock. Blood cultures are drawn and broad-spectrum IV antibiotics initiated after initial fluid bolus fails to improve status. A construction worker falls 2 stories landing on his left side. On secondary survey, he develops shock, not yet responsive to crystalloids. Have blood products available on standby, along with administering vasopressors if needed, based on trauma center massive transfusion protocols. A hospital nurse finds an unresponsive patient with no pulse and agonal respirations on the cardiac monitor. She pulls the code cart to the bedside while calling for the code team, who will work through the ACLS pulseless arrest algorithm, advanced cardiovascular life support measures. After Ross post-cardiac arrest, the ICU nurses maintain targeted temperature management between 32 to 36 degrees Celsius, along with controlling blood glucose and serial neurologic assessments to limit reperfusion injury during post-resuscitation care. An elderly patient is found unconscious with slow irregular breathing concerning for opioid overdose. Support ventilations with BVM while preparing naloxone to reverse respiratory depression once advanced airway is secured. A worker develops chest pain and shortness of breath while clearing brush. The paramedic crew acquires a 12-lead ECG showing ST segment elevation concerning for myocardial infarction. Administer oxygen while expedited transport is arranged for potential cardiac catheterization. An unrestrained driver is found ejected from his vehicle approximately 15 feet with significant intrusion into driver compartment. Maintain C-spine immobilization during assessment for multi-system trauma, and have blood products ready on standby due to high risk of hemorrhage. A victim entrapped in machinery has extensive lower extremity crushing injuries with arterial bleeding not controlled with tourniquets alone. Apply hemostatic gauze packing with direct pressure simultaneously while arranging for rapid extrication, then surgical hemostasis. An agitated, diaphoretic patient at a music festival complains of the worst headache of his life. Assess for concerning signs of CNS bleed or aneurysm, including elevated blood pressure, nuchal rigidity, or neurological deficits, which would prompt emergent neuroimaging. In a rural clinic, a child experiences fever, rash, swelling, and difficulty breathing, raising concern for anaphylaxis. Administer IM epinephrine, IV diphenhydramine, IV fluids, provide supplemental oxygen while monitoring end-tidal CO2 post-intubation en route to the closest hospital. A pedestrian struck by a vehicle presents with unilateral absent breath sounds and hemodynamic instability despite fluid boluses, concerning for tension pneumothorax. Perform needle chest decompression using extended catheter without delay at the second intercostal space midclavicular line before transport. A combative head bleed patient requires air transport but becomes increasingly hypoxemic. Plan for possible rapid sequence intubation medications if unable to oxygenate with basic maneuvers in order to secure the airway definitively before decompensation worsens. A hospitalized patient develops sudden onset left-sided weakness with non-contrast head CT negative for bleed. The stroke alert team evaluates symptom duration and contraindications while preparing for potential fibrinolytic infusion to restore cerebral artery perfusion. First responders arrive on scene after a reported opioid overdose, where the patient has agonal breathing and is unresponsive to stimulation, suggesting respiratory then cardiac arrest. Begin chest compressions and prepare naloxone for when IV or IO access is obtained to reverse opioid-induced respiratory depression.